Chris Blakely is a physiotherapist who completed his PhD at the University of Ulster in 2004. He has published over 35 original publications in international sports medicine journals, including clinical guidelines on acute soft tissue injury management. Chris completed a UK Cochrane Fellowship in 2010 and currently works as a lecturer at the Ulster Sports Academy.
Before we start, we would like to stress the health benefits associated with running are copious and by far outweigh the number of risks. We will provide a compendium of facts about running and provide an overview of some important ways to prevent injury. Our main aim is to provide evidence-based facts to make running more safe and more enjoyable. Firstly, some important definitions. Epidemiology. This is the pattern of injury in a given population. Prevalence. This is the number of cases of injury in a given population at a given time. There's been much research into the prevalence and prevention of injury in running over the past few years. An excellent systematic review of epidemiological research into running injury was recently published by Lopez. As you may expect, the majority of running injuries seem to occur around the lower limb, particularly below the knee. The Achilles tendon, plantar fascia, and the shin region had the highest prevalence of injury. Now that we've established the most important types of injury, the next step in prevention is to determine important risk factors associated with each type of running injury. You may be predisposed or susceptible, depending on the number of risk factors you may have, and also whether these are intrinsic or extrinsic to your body. Intrinsic risk factors are those that are personal to you. In running, higher age and higher levels of body fat are associated with injury, particularly those involving the Achilles and plantar fascial regions. We also know that another general risk factor for musculoskeletal injury is having a history of injury. If you fall into one or all of these categories, particularly if you're a first-time runner, then you should progress your running program slowly. Decreased flexibility is also an important risk factor. Ankle dorsiflexion, which is the movement shown in the picture, is particularly important. Decreased ankle dorsiflexion can place stress on structures above and below the ankle and induce poor movement patterns during running. An important consideration is that decreased flexibility is a modifiable risk factor. Therefore, it can be changed with the right intervention. Regular stretching can improve flexibility over time, and this should be incorporated before and after training runs. Please refer to the Performance Marathon presentation, Part 2, for more excellent information on this. Intrinsic risk factors are those that are personal to your body. Extrinsic risk factors are factors outside your body. Again, these can be multiple and can include things like types of running shoes you use, your recovery strategy, diet, or even sleep. These are important and in most cases can be successfully modified with the right advice. I have chosen to focus on one of the most important extrinsic risk factors, which is training load. Remember, running a marathon places a significant amount of load in your body. If you're an average runner running at 80 strides per minute, then you will take just under 20,000 strides during a 4-hour marathon. If we conservatively estimate that each stride creates an impact force of 3 times your body weight, then you will accumulate around 4 million kilograms of load during a race. To put into perspective, that's about half the weight of the Eiffel Tower. Much of the force that accumulates during a run is dampened by the tissues in your lower limb. These tissues include your plantar fascia, which is a tough non-contractile tissue on the sole of your foot, your Achilles tendon, your calf muscles, thigh muscles, knee and ankle joints. If you're an efficient runner, these tissues act almost like a complex spring and are able to transfer the vertical impact forces into forward propulsion. Another important fact to consider is that the body gets better at this process over time. It does this by adapting so bones, tendons, and muscles can remodel and strengthen in the right places. Unfortunately, proper tissue adaptation can take quite a long time. For this reason, you need a number of months of progressive training to safely prepare your body, and in particular your lower limb tissues, to prepare for a marathon. Strengthening exercises are also important in this regard, as they ensure that muscle tendon units are more robust and therefore less prone to breakdown. Take the time to include strengthening exercises within your weekly program. This is by no means an exhaustive list. Runners at most levels will benefit from undertaking some of the following exercises: single leg squats to enhance balance, quadriceps, and gluteal muscle strength; calf raises to strengthen the muscle tendon unit within your calf region; bridging exercises which target the gluteal, hamstring, and trunk regions; and side planks to strengthen the oblique and hip abductor muscle groups. In general, maintaining good form and good technique throughout these exercises is more important than the number of repetitions that you can do. Importantly, ensuring progressive running exposure with adequate recovery time is essential. Runners should avoid sudden changes in training load. Shocking the body with sudden increases in speed, distance, surface, or frequency of training will significantly increase your risk of injury. If you get injured in the lead up to the marathon, don't panic. Seek help as soon as possible. Early detection of injuries, particularly overuse injuries, is key. Acute injuries should be managed using ice compression and elevation, and consult a medical practitioner prior to using non-steroidal anti-inflammatory medications, as there is increasing evidence that these can be detrimental to recovery, particularly in bony and muscle injuries. Pain is an important aspect of evolution, so don't ignore it. The longer you run through pain, the more tissue damage that is likely to occur, and the longer your rehabilitation period will be.